But then my ustad said, no, I think we have enough people, studying in religious studies. We are short of doctors.
Good morning. Welcome to the Breakfast Grille. The doctor is truly in the house, and it is with great pleasure to have in the studio Tan Sri Dr. Noor Hisham Abdullah, Chairman of UCSI Healthcare Group and also former Director General of Health, as we have a broad-ranging conversation of how he helped steer the country out of the pandemic, the future of healthcare in Malaysia, and whether we are ready for the next pandemic. Good morning, Tan Sri. Keeping well?
Good morning. Thank you for having me this morning.
Well, let's get a bit personal before we talk about the weightier issues about our country's healthcare infrastructure and talk about your retirement. I mean, you announced your retirement from civil service April this year with an illustrious 35-year career in the Ministry of Health.
Exactly.
When the press interviewed you, you said rehat dulu, which means rest a bit. Yeah. But today, you're now a senior breast and endocrine surgeon at Putrajaya Hospital. You're UCSI Healthcare Group Chairperson, University of Cyberjaya Chancellor, Chair of WHO Pandemic Committee, and more other committees you chair. Is there something I'm missing about the concept of retirement?
Well, I think retirement is a blessing actually, after 6 months of cooling period. So it's very exciting. And I think my career just started in the private sector. But the experience that I had in the public sector, I think helps a lot in terms of the planning and then sharing our experiences with the private sector, especially in the universities and also in private hospitals.
I'm quite keen to understand whether the motivation has evolved. I mean, when you shift from public to private sector, many say that, we enter this second phase of life, this second mountain. Does your motivation change? Does the drive evolve a bit as you take on these new roles and responsibilities?
Well, the principle is still the same, just that the focus may be a bit different. But I think we have to work on the principle, common pathway, common target and goals, whether it's the public sector or private sector. But obviously, you need to look into sustainability and etc. So I think the experience that we had in the public sector is very important. And now we are looking into how we can integrate the public and the private sector. Because our health system is a dichotomous healthcare system. And, is how can we actually bring these two sectors together? Although in theory it's good, I think I'm looking at the perspective of the country. How can we optimize the resources in terms of the facilities, in terms of the human resource and etc. Optimize the resources from both sectors. Now you can see the sectors that, the rich can actually access to treatment in the private sector, and also in the public sector. Because if the service is good in public sector, they will come in the public sector. You can't deny them because they are the taxpayers and etc. But the poor have no option. They only have to go to public sector. Now, how do you integrate the two sectors together? I think we have talked about this for years, but the pandemic has actually given us the opportunity to see the integration between the public and private.
That's right. Because you've always talked about this all of society approach, isn't it?
That's right.
I think that came really to the fore throughout the pandemic. And that's where you see perhaps the relationship between public and private actually deepen quite a lot there.
That's right, yeah. So I think working together, we already have the concept, but to come and work together within public and private sector, the whole government and whole society approach, I think that's important. So we can optimize the resources for us to control the pandemic COVID-19, for example. So if that can be done, why can't we do it for non-communicable diseases and etc.? So again, we must look into the model of how we can actually optimize our healthcare in this country.
But do you think there's misgiving and lack of trust from the public side when engaging the private healthcare sector? Do you think there are concerns about profiteering, right, on the private healthcare side? How do you address that?
So
concern?
we need to mitigate in terms of how can we provide services high impact, good quality, and reasonable cost. It's not cheap, but it's reasonable cost. And if you compare Malaysia healthcare, the cost and with other countries, I think we are among the much cheaper. And that's the reason why I think our Malaysian Healthcare Travel Council able to actually attract a lot of, health travellers to Malaysia. One is quality is almost the same, but at least the cost is much cheaper. Likewise, if you look into our service industry and hotels, our hotels are much cheaper if compared to the other countries. So I think this is our advantage that we can actually ride on and see how best we can enhance it further.
And just building on the earlier reference you made that actually for the healthcare infrastructure has to serve both those who are well-to-do and poor. And,
Exactly.
And just reflecting on your background, I mean, you did not have an easy life, right,
Yep.
as a person. I mean, you were born Yo Ming Seong in a poor family in Sungai Pelik. You were raised by a single mother in flats in Pudu. You were then adopted by an ustaz. I wonder when you were young, right, was the ambition and goal for you to be a doctor?
Well, I started with a very humble beginning, and many of my friends and even many of the public knows that I'm adopted. So I'm adopted to a Chinese family. That's number one. And actually, in the news that you read, is not exactly the truth. Once adopted, and then there's my mom and dad, adopted mom and dad split. Separated, and then my mom converted when I was still, I think probably 3 or 4 years old. Then I started, being educated, and then in a different culture, and adopted by ustads in a different environment.
Yep.
So I mixed very well with Chinese, Malay, and also Indian. So it makes me more Malaysian actually. So understand the three cultures, and also in terms of religion, I also understand all the religion. And this is something that I think give me the advantage to understand each culture and religion.
Empathy
as well,
Yeah. And this empathy, I guess, was an easy transition then to consider medicine as a profession then.
I see, those days I'm not sure, there's actually identity crisis. But when looking back, I think there's an advantage because, you are able to understand every culture and religion. And that is certainly an advantage in understanding, and you can engage with the respective communities well, from all the communities. That gives me the advantage as a doctor to communicate, to engage, and to empathize with them if needed be. And I think that is certainly a good experience looking back on the hindsight.
It must have been. I mean, I think, what I'm more interested to understand is that shift from being a doctor to actually being a classic civil servant, right? Why did you make that shift from being on the ground
Well,
practitioner?
many of us do not know that, I wanted once upon a time to be a religious officer or even to be a mufti, right? But I went to a Muslim college in College Islam Klang, and then my ustads actually groomed me, and then I was sent to a science stream, for Science 1. At that point of time, I was quite hesitant because I wanted to go to the religious study art stream. But then my ustad said, no, I think we have enough people, studying in religious studies. We are short of doctors. I know. I want you to zoom in and focus to be a doctor. So that's the reason why I continue. That's in the Muslim college lah. So maybe he has a foresight to see.
Possibly that he could deploy you in other better ways.
That's right. Yeah.
But it was very interesting that you decided that you fell in love with the profession, but then decided to take on a managerial position. Right? Was it hard to transition
it's
to take on that
actually,
administrative
because
role?
I was offered at the age of 40. I just came back from Australia about 6 years. I was training as a surgeon. I graduated as a surgeon when I was age of 30, and I did my training in Australia. So, when you come back, you just want to continue to operate and also develop your unit, breast and endocrine unit. And then I was offered, but I was quite hesitant, and then I rejected actually to be the deputy DG at that point of time. But then I understand 3 years later, there's also another vacancy, and I was approached again. But I understand that, to run an organization, as a surgeon, I would like to operate all the time. But, as an administrator, at least I can actually look into the needs of the hospitals,
bigger fraternity.
So again, I can see top-down and bottom-up approach. sometimes the top do not understand the bottom. But when you comes from the bottom, providing services at the hospital at ground level, you can actually understand the situation much better.
That's right.
So it's not only top down, but it's also bottom up.
Yeah.
But the negotiation is that I'm still allowed to practice 1 day a week. It's for the last as a deputy DG, and also run my clinic 1 day a week. So 1 day a week for surgery and 1 day a week, a half day a week for my clinic. So I've been doing it for the last 6 years.
And still doing it now.
Yes, as a DG for the last 10 years, I was still doing it. So I've been practicing, and I still continue to present cases and also share my experience in conferences. And in 2010, I was invited to give a talk in the British Journal of Surgery lecture in Birmingham. And 2019, World Congress of Surgery, when I was a DG then. So, which means, I think I try my best to strike a balance between administration as well as in my professional development.
So let's fast forward, right? I mean, you're now revered. I mean, many call you this national hero and icon. We won't talk about the numerous titles, honors, recognitions you've received, right? But are you comfortable with this adulation, with this hero worshipping? Does it make you feel, squirm in your seat?
Well, being a DG is not about me, actually. So it's not...
but it's so much high spotlight on you, though.
Exactly. But I mean, our target is very clear. Basically to come up with a solution to control and even to contain the infection. So we are trying our best. As a surgeon, you have to make a decision and then focus to come up with solutions. So that is more important rather than the person. So it's not me, it's a teamwork. It's a Ministry of Health and the whole government involving all the frontliners in other ministries as well. So I think working together is important. It's the key to success. And that's the reason why I always say it's not about me, because I'm just representing the Ministry of Health and the voice of the Ministry of Health.
Now, Tan Sri, let's just talk a bit about return on investment, right? Because as you were navigating throughout the COVID-19 pandemic, do you think the pandemic has clarified the value, the return on investment that the government needs to make in public health?
Well, I think we need to leverage on this lesson learned during the pandemic. I think we can actually improve the way we do things differently and how to optimize the resources. There are many lessons to learn in this pandemic. I think one of it is how to integrate the public and private sector together. That's number one. Second, to use the IT, IT system. When you have to manage, big volumes of patients and etc., sometimes it's difficult to do it manually. So IT helps for us to move forward. And I think engagement, I think this is also very important for us to engage with stakeholders, patients and etc., and the public, and how to empower the public. And most important is how do we change the behavior of the public, to do the things that the do's and don'ts, in terms of during the pandemic, for example, how do we lead the public to understand the disease and also they know exactly what to do, what not to do.
So really 4 key things, right? Collaboration that's really broad, private-public is 1. Second, really investment in digital.
Yes.
3, optimizing our communication and really having a bigger conversation about public health, right? I mean, you seem to articulate these 4 key lessons here from the health. Do you see that reflected in Budget 2024 and even in the healthcare white papers?
Well, I think if you look back, I think at least this year we see some improvement. I mean, almost about 13.9% of increment in the budget, totaling about 5.9 billion, almost to 6 billion, which is a good start. But I mean, before the pandemic, 2019, I have retweeted we are underfunded, understaffed, right? Our hospitals.
And it always fell on deaf ears.
Yes. I think this is the real issue. We need to invest more in healthcare. If you were to look back, if our projection is 6% of GDP for the whole country, at the moment it's only about 4%, 2.1% from private sector and 2.2% from the public sector. So it's total about 4.2, 4.3%. So in our country, we should be investing at least 6%. So 6% means additional 2% from the budget. And 2%, additional 2% will cost us about 60 billion instead of 41 billion now. So obviously, I think at least we can plan towards, the increment of the health budget over a period of time in stages, for example. So at least this is a good start. This year is a good start. At least there's an increment of 5.9 billion. Now, the fund is one thing. Second is that how do you use this fund?
The allocation
of the
That's
fund.
right.
So I think, healthcare is a bottomless pit. And then we need to really look into how do we invest in a healthcare system now. So instead of investing in curative, we need to shift in preventive and the well-being. So reduce the cases rather than increase the facilities and hospital. We still continue to upgrade some of the facilities. But if you can reduce the cases, for example, then you can reduce the load in our hospital and the clinic.
But we seem to struggle, right, in targeting this preventative healthcare well. A classic example is recently the GEG, the Generational Endgame Bill. We just can't seem to get our act together to get that done, right? These are critical policy tools that are preventative in nature, but somehow we just can't seem to pass over.
Yeah, if you look into the healthcare, it's not only in Ministry of Health. I think, it's the whole sector had to come together. More important for us to transform the healthcare system, we need a strong commitment and political will to do it. So the question is not only from the Ministry of Health, but from other ministries to support. Every sector is a health sector. We know that, health is wealth, and we have seen that. During the pandemic, certainly, health is so important.
It clarified that return on investment.
That's right, yeah. In the long run, I think how do we invest in healthcare? So I think today, for example, we need to focus mainly on preventive measures. I just give you a simple example. During the pandemic, every hospital have a trauma OT. During the pandemic, because of the lockdown, we have hardly any trauma cases because of the lockdown, which means if we were to invest in our road safety, road traffic and safety, guidelines and safety, so perhaps we can actually reduce the trauma cases. Likewise now in preventive, so, invest in terms of cervical cancer, so in terms of vaccination and etc. So I think that can improve in terms of reduce the cancer cases. So otherwise, there's a good example. I always quote this. Once upon a time when I was a trainee, and when I go on call, there will always be a bleeding, from GI bleeding, upper GI bleeding, etc. So we have to do a procedure, underrunning ulcer, truncovagotomy, and pyloroplasty, and etc. But when they introduce a pill, a proton pump inhibitor, that procedure is really obsolete, and today you hardly see any bleeding from peptic ulcer disease. So one pill keep the surgeons away, for example. So now there's a lot of investment we can do. For example, folic acid, now fortification in our food, etc. We can reduce the incidence of neural tube defect and etc. So investment for now in my field, we have multinodular goiters and etc. Huge goiters. If we invest in iodine fortification, we can reduce actually the cases. I think the most important is how do we reduce the cases, and then we can actually reduce the cases in our hospital and our clinics.
So you make a very interesting point that this healthcare reform is an all-of-government approach, all-of-society approach, right? Yeah. I wonder when people construct this healthcare white paper, right, are all ministries engaged to make sure that they take these actions in place? Because it clearly requires some cross-ministry engagement to make this work.
We have been discussing about the healthcare reform for the last 40 years.
Yes.
But we need strong political will and commitment. Now, the white paper was mooted earlier is because, every new government comes in, they have their own perspective of how to transform the healthcare. So we need to have a white paper. White paper means white, and then engage with all parties, and then table in parliament. So if we can get the bipartisan support for this healthcare white paper, and everybody agrees that we need to transform our healthcare system in this country, and regardless of the government of the day or the ministers or health ministers, come and go. But more importantly is the white paper is available and continuity, so that one government to another will continue to implement what have been agreed upon. So I think we have tabled this in Parliament, and then everyone, bipartisan support, agrees to this white paper. But now we have to discuss in detail what is the healthcare transformation. How are we going to transform? In terms of the financing, in terms of the structure, and etc. The system that we need. I think this is where I think the engagement is still ongoing. And hopefully that we can see how to optimize the resources, not only a sector, not only in public sector or private sector, but integrating both sectors.
I mean, you talk about resources. I mean, we've had so much conversation about how medical professionals are under so much pressure, a lot of underpaid. I mean, you went through this whole period of, navigating, potential strikes, issues where, there's burnout taking place, mental abuse happening, right? How do we, fix really one really critical core position, which is really the core talent of the health industry, right? Healthcare sector.
So I think we need to look into our human resource. Very important to look into our human resource. They are the key success of any organization. I think, and we understand in the public sector, we are short of positions, permanent posts for our doctors. But at least we can actually look into other options. And we have come up with a suggestion that, to allow permanent posts, but not pensionable, but it is under the EPF. So if it's, you offer a permanent post under EPF, that perhaps will solve some of the problems that we have. And it's important for us to continue to train our doctors, our young doctors, to be specialists in time to come. And most of the private sector, they are not involved in the training. Most doctors or specialists in the private sector, once upon a time, they are from public sector. So this is important. But we are also looking at the option of how can we use the private sector for training or postgraduate training, for example. So we have, encouraged the integration of the training of the specialists in the public sector and also in the private sector, to integrate both sectors together as one.
Dr. Tan Sri, we just had a conversation, throughout the break that actually many of us feel that the pandemic is a very distant memory, and the biggest fear is that we become complacent.
Exactly. Yeah. Well, our concern is, every success will lead to complacency, and complacency will lead to failure. Having said that, I think important for us to re-look back again and see how best we can learn from this experience and to improve our healthcare system. I think there are 4 things that we need to do at the moment. How can we enhance our surveillance? We are talking about genomic surveillance and etc. Second is obviously our health system, and how can we continue to strengthen our health system, invest more, and and our health system is can adapt. For example, during the pandemic, we have to close down our hospital totally. And that's not good because we neglect a group of patients, NCDs and etc. Those needed operation all been postponed. Almost 60,000 operations been postponed. So the best is that you have a system that we can continue running parallel during the pandemic. Third is that we need to empower public health measures in the country, meaning not only the Ministry of Health. Each individual, families, communities know exactly what to do. For example, a simple thing, you have a upper respiratory tract infection, put on a mask, you think you got a fever, etc., stay at home, take your own
precautionary
measures. Stay away from crowded places and confined spaces, etc. These are all good practices that we need to perform when we have this situation. And last but not least, I think important for us, to apart from the public health, I think investment in public health is important. When we return to the norm, and you can see that if things are as usual, that means public health is functioning well. But sometimes we do not, we forget about the public health people. We only know the doctors, consultants and all in the hospital, but not the public health sectors. So I think this is important investment for us and train more people, more specialists in public health. And last but not least is behavioral change. This is we have championed this in the World Health Assembly last year in terms of how do we empower our public to do the needful, the do's and don'ts, in terms of our daily life and living.
I mean, you talk about the actions we have to take now, regardless of whether we have a pandemic or not. And I just want to put you on the spot, though, because you are a chair of the Global Committee on Pandemics with
Exactly.
WHO. What's the likelihood, right, for us to experience another pandemic in the coming years ahead? And are we ready?
Well, that's the reason why I think we're learning from this experience of pandemic COVID-19 and then to enhance our response. This committee basically looked into health emergency, prevention, preparedness and response. So certainly our response today will prepare us for the future. But I think we have 194 member states and we need to coordinate the response, align in terms of the things that we do from each country to another. And this is important because, if we have 194 ways of doing things, that will be haphazard. So now in the Ministry of Health, in this committee, we are looking into 5 areas. Number 1 is surveillance, collaborative surveillance. How can we come together and share information, for example? If there's an outbreak in China, we want to know about the virus, the genomic sequence of the virus, so that we can prepare. In other countries can prepare. So this is important, collaborative surveillance, including the genomic sequencing, etc. Second is community protection. How do we protect our community? So it depends on the healthcare system in terms of how do we, are we ready, our health system, to respond to a pandemic? And third, we look into the clinical scale up in terms of, if there's a need, search in the cases in the hospital, whether our hospital can, respond and accept more patients. For example, if you have 10 ICU beds, so and when the need it arises, and then we need to actually transform and even convert some of the wards to become the ICU, for example, increase the oxygen supplies and etc. So this is where you need monitoring of the whole system, and utilization helps. For example, we know exactly how many patients comes to our hospital, and then our capacity of the hospital in terms of our needs. For example, the use of our glove, PPE, whether it's adequate or not, etc. So I think you have a monitoring process ongoing. So this is the improvement of our health system.
And this process system, right, as you correctly point out, has to be coordinated and actually have some alignment across the world, because that was clearly a lesson learned throughout the pandemic, isn't it? Some countries decided to do their own thing, adopted herd immunity. Right. We had also shifts and all that. That's also one of the biggest issues and lessons, right? The lack of coordination and unity in how we approach these things.
Yeah. So I have mentioned earlier surveillance, community protection, and then clinical services to scale up during the pandemic. And then the fourth is countermeasures of vaccine, therapeutic drugs, and as well as the diagnostic. So we can see during the pandemic, the rich country will buy all the vaccine and the poor countries have no access. Equity is the issue. How do we address this in a global platform? Last but not least is the cooperation in the emergency response. So we are not talking about outbreak only. We are also looking into a health crisis, for example, wars and etc. How do we provide services to this region? So I think these are the things. Yeah. Initially, during the pandemic, we have 2 approaches, herd immunity approach as well as prevention and control approach. In the Ministry of Health in Malaysia, we have always adopted prevention and control approach. We have an Act 342 for this implementation. But when we look into other countries, we have a leeway of 6 months earlier to learn from others because the outbreak was in other countries. So the do's and don'ts, so that we do not repeat the mistakes being done. So in Sweden, for example, they adopted the herd immunity approach to allow the infection. Yeah. And then the young ones, when they get infected and they recover, they have the natural immunity. So they protect the high-risk group, the elderly and etc. But we do not know about this virus. This is a new virus, So And the lesson learned is that, this virus spread, very fast, and then the fatality is very high, including the young ones. So the mistakes that we see that if we were to use the herd immunity approach, we will end up with fatalities, especially the young ones. Not only the elderly, but also the young ones.
You articulate it so clearly, but I can remember and reflect during the pandemic, it must be very hard to make sure everybody sings on the same hymn page, isn't it? Because you also got a lot of criticism throughout the pandemic. And also what doesn't help is, honestly, there was this whole change of political leadership.
Exactly.
I think you actually served 5 prime ministers, 6 ministers of health, right, with multiple political setup and makeup. Do you think this whole political transition actually made it very hard for you to do your job well?
Well, at that period of time, it's not only a health crisis, it was also an economic crisis and political crisis. Managing the political crisis was difficult because we are the center in terms of in Ministry of Health. We are trying to build trust in the Ministry of Health in terms of engaging with the public, explain all the issues and challenges daily to the public, and then try to manage the expectation of the public and to win the public trust. When it's been politicized, that is our issue now in terms of maybe Ministry of Health being attacked, to get to the government, and government is using us to defend against the. So this is how do you strike that balance? It's very challenging during that period of time.
Because it's not database, isn't it? That's the issue. It's not fact-based.
So what we did is actually we need to, focus and then rely on facts, data, and science, not political, perspective, but use facts, data, and science to guide us out of this situation.
But you must get a lot of pressure to open up and, not extend the lockdowns further, right? I'm sure business communities, every members of society were giving you a lot of pressure. How did you hold your nerve and say, no, the answer is that we have to do this because we have to flatten the curve, right? I'm sure you had a lot of pressure.
You need to strike that balance, in terms of, when we declare the public health emergency of international concern, we are looking into 3 areas. Number 1, infectivity. It means very high infectivity of this virus. Second is the fatality, very high fatality. And we heard earlier in Iran, in China, people are dropping dead in the streets, on the streets, and etc. And last but not least is the economic impact. So how do you strike the balance with life and livelihood, health and economy, and also politics, for example? So this is important for us to make sure that if we all can come together as one, this is why I think we adopted the whole government and whole society approach, and engaging with everyone and in the public to come together so that we can address this issue, and hopefully we can actually transform the healthcare. And when we say transforming the healthcare, we will start with individual. How do we change the behavior of individual, family, and group before we look into the Ministry of Health? It's not a responsibility of Ministry of Health alone. It is a responsibility of all of us, actually, in healthcare in this country.
Tan Sri, I think we have so much more to cover, but I just want to conclude with just one last question to you, right? And it's a hypothetical, right?
Right.
Let's assume that Dr. Tedros does, not continue on as DG of the World Health Organization. Would you consider that post?
No, I think we have to look into the geopolitics because there's a lot of the nomination is based on geopolitics. It's not based on professional. So certainly, I think this is a very challenging post. It's not an easy one. We recently had a engagement as well as the appointment of regional director of the WHO in the Western Pacific region. And I think the region have actually nominated and appointed a representative from the Minister of Health from Tonga to take the lead. I think this is something that, is not only from the technical perspective, but also you need to look at the political perspective. Geopolitics is important, whether we have the support from the region and from the whole globe, for example, whole country, whole world, for example, for this position.
Regardless of whether you take on this position, we would like to all thank you for your service here. On the Breakfast Grille, Tan Sri Dr. Noor Hisham Abdullah, former DG of Health, as we unpack how he helped us navigate throughout the pandemic. I'm Philip C., BFM 89.9.